Hello, I'm Dr. Patrick McGrath. I'm the Chief Clinical Officer at OCD. Now, the treatment for obsessive compulsive disorder is really a specialized treatment. It's called exposure and response prevention therapy. It's more specialized than a general cognitive behavioral therapy, or CBT as it's often referred to. And in fact, many therapists who are cognitive behavioral therapists are actually cognitive behavioral therapists, where they focus more on talking about things than they do on the behavioral components of it. And I can tell you this from 25 years of experience in treating OCD, I've never once talked anybody out of obsessive compulsive disorder. I either missed that class in graduate school or it's just not possible. And I'm going to go with it's not possible because I attended all my classes in graduate school. Now, that might be disappointing to you, right? You might think, well, I want to get talked out of this and I want to explore this and I want to know why I'm having this and all these types of things. And it turns out that's really not as important as learning that you can handle whatever it is that pops into your head. A general therapist or somebody who does more of a general CBT might do things like give you safety behaviors. They might teach you diaphragmatic breathing exercises, muscle relaxation exercises, and say, if you do these things, that will help you get through all of this. But what it doesn't do is stop the compulsions. They still occur. They're still going on. Therefore, a treatment that doesn't help someone overcome OCD by teaching them how to not do compulsions probably is not going to give them any kind of result that they want whatsoever. ERP, or exposure and response prevention therapy, which is really that behavioral component of cognitive behavioral therapy, is really the key thing that needs to be done for OCD to start backtracking, to have it not rule the life that it has been ruling. So you want to live the life you want to live? Do exposure and response prevention therapy. And it's two parts. We'll purposely expose you to the images and urges and thoughts that pop into your head. Those are the obsessions that you have. And we will have you not do compulsions. That's really what response prevention is. You're preventing that typical response. And what is the typical response in OCD? Well, just like the moniker says, obsessive compulsive disorder. You have an obsession. What do? You do a compulsion. We want to stop you from doing the compulsion. We want you to learn that it isn't actually necessary. If compulsions were necessary, we would teach all sorts of people to do compulsions. And we would say, hey, looks like you're having a rough day. Have you considered some OCD? I'd lose my license for that. That would not be a good thing whatsoever. Instead, we know that it's the compulsions that actually keep people stuck. So reach out to us at nocd.com, where we have expert therapists available for you. We train our therapists in exposure and response prevention therapy. They know how to help people with obsessive compulsive disorder. Not only do they go through weeks of training at the beginning of their time with us at NoCD, they go through tests and exams, they go through mock sessions, and for the rest of their tenure with us at NoCD, they have access to great consultation groups as well as continuing education in OCD as well. If this sounds like a place that you want to go to and you want to check us out, go to nocd.com. Talk to our care team. Do a free 15-minute call with us and let us show you how NoCD might be the solution that you need in order to finally overcome obsessive compulsive disorder.